All right. Number 1, disorders in which the parts of the ear usually result in earaches. A, B, C, or D?
A or D's.
C, middle and external ear. Remember yesterday when I gave in lecture, I said there's the external ear and then just behind the tympanic membrane? That's where typically it happens. Okay? Eye discharge is usually associated with which? Conjunctivitis, correct. That's also known as? Pink eye. Yes, ma'am.
For this one, can you point at the external, like, I need to visualize it. So can you show me, like?
The ear canal, from so out here to the pinna, all the way in till the tympanic membrane is considered the external ear.
Oh.
After the tympanic membrane, but before the cochlea is the middle ear. The inner ear is the cochlea and all the nerves that help conduce, or that send the vibration signals and interpretation to the brain.
Okay, that makes sense now. Okay, thank you.
I'm gonna need my cane here.
I'm like, we've got one instructor down. We don't need 2.
Well, we do have 2 down.
She's going to.
He's going to go ahead and have his lunch. Okay, number 3. Which type of hearing loss results from disorders of the inner ear or of the 8th cranial nerve?
Sensorial nerve.
Really? You also very, very smart. Well, the rationale is conductive hearing loss results from external or middle ear disorders, which he just went over, okay, that blocks sound transmission, mixed hearing loss from a combination of conductive and seroneural problems, and functional hearing loss from physiological factors. So think about it. If you're hearing in the middle ear, think about swimmer's ear. When you all get all that water in there, do you hear very well? No. So it's the same principle. If something gets into that middle ear, you can't hear much. It also causes you to get a little balance problem. Okay, same principle. Okay, that middle section of your ear, something gets in there, you build up a wax, you all just like, hello, anybody home? Causes a problem. That middle portion of your ear is the most important, okay? Causes you some serious problems there, okay? Okay, number 4, which item is used to test for corneal sensitivity? This one is kind of tough, unless you work in a neuro department, like neuro ICU. And I used to have to do this when we were taking patients off the ventilator and whatnot. You would actually take, and it's D, a wisp of cotton, okay? What you do is you take this cotton ball, and you would take just a tiny piece of this and you roll it up. And hopefully your patient is not with it at all. And you take this very tip of this, you would open up their eye and you would run this across their eye. Yeah, it's terrible. But the neurodocs do it, not us nurses anymore, because you could actually cause a corneal scratch. Us nurses, I got to the point where I would just take a gloved hand and run across their eyelashes, because what they're looking for is a blink reflex. You can get a blink reflex just from their eyelashes. You want to see if they're going to blink, and that's what they're looking for, is the blink reflex, okay? And every time I saw them, sometimes you can even take the cotton swab and pull it out a little bit, the cotton off of there, and that's what they use sometimes too. And every time they did it, just made me want to go, let me get you some eye drops. Okay? Number 5, what should you palpate before inserting the otoscope into the patient's ear?
Tragus?
Tragus. This part right here. Right here. Why do you do that?
Is it pain?
For pain, correct. Yeah, because if you push on this and they're screaming at you, you really got to be very, very careful. You let the doctors know that you kind of palpated this and they about jump straight out of their skin. They're going to be very careful if they're going to look in that ear. Because usually if you push on this, they have already know that they have an earache, and that is why they're there to start with. Okay? All right. Which symptom commonly accommodates throat pain? It all is station 2. Goes together all the way down to your throat. Okay? And what nerves do you know go with that? Anyone know?
Like the cranial nerves?
Yeah, they're cranial nerves. 9 and 10. And we'll go over that here shortly. He has this lovely article here that tells you exactly where all your cranial nerves are. And I'll pass that out shortly, okay? All right. Yeah, okay, number 7. If your patient presents with severe epistaxis, what is important for you to check quickly?
D.
Their vital signs. What is epistaxis?
Nosebleed.
Exactly. How do you stop a nosebleed? Anyone know?
Pinch it and ice.
Say that out loud.
Bend them forward with their head between their legs, so they can get that far. Ice pack to the base of their head and their nose down.
Exactly. What do people normally do?
Lean back.
And what's going to happen is all that blood drains to the back of their throat and causes them to throw up, causes more bleeding. It's not a good sign. Okay? Okay. What is the most common symptom of, I can't even say that word today.
Esophageal.
Thank you. Disorder.
Dysphagia.
Dysphagia, correct. There are some words in this world I cannot say. If your patient complains of pain as they begin to swallow food, which phase of dysphagia would you classify this as?
2. I'm wrong. 1. I don't know.
1. The key word is begin to swallow. Just the very start of swallowing is the key words always begin. Okay? Pain when food is beginning to be passed to the back of their throat, the very start. That's at the transfer phase of swallowing, and that's considered phase 1 because it's transferred from the tongue to the throat. Okay? Which cause of the nasal obstruction is life-threatening?
A.
Basilar skull fracture.
What's a skill fracture?
Yeah, it's not a skill, it's actually a skull. So these are kind of things that you're going to have to, these are going to be what we're looking for in all of your classmates today. Okay? How many got 1 wrong? Or none? How many did you get wrong?
1. The number 9.
Number 9? What was number 9? I forget.
The phase.
The phase, yes. What did you get wrong, my dear?
Whisper cotton.
Whisper cotton. And a lot of people don't know the wisp of cotton because
I didn't know that.
I
That
just
was, they have, that's an ATI something.
did you see it on ATI? Yeah. Okay. And a lot of people don't know that because if you've never worked in neuro, who got 2 wrong? 3 wrong, 4 wrong, 5 wrong. A lot of this is all new to you, so we don't fault you. This is why we gave you this to you, okay? So, I'm going to pass this one out to you. This is facing cranial nerves. So it's this lovely little picture here, and it also explains it to you. This is cranial nerve 7. 3 is your eyebrows. 2 is your eyes. Okay. 1 is your nose. Okay. 5. 6 is here. Okay. 4. 10. All of these go together. 9 and 12. Bless.
Thank you.
They all go together. Okay? And there's little mnemonics in here to help you remember what each cranial nerve is. This is a very interesting article. And believe me, I get this magazine. Nursing Made Incredibly Easy. Believe me. Get this magazine. I've been getting it for years. It's very helpful. Okay? It's on the bottom here. They have so many, and you can get a lot of CEUs once you sign up to this. It's like, boom.
What did she was?
You wear your hair
Oh, that's you?
That's
I'm
another
used to
person.
it. Well, I'm used to it too, but no, I'm not. Fuck that shit. No, I have to have my hair colored. But I don't like it.
This is going to be helpful when you guys
can't wear
start what we call the
Because I
HEENT.
have to put my hair down.
Head, ears, head, eyes,
Just
ears,
so
nose.
much.
Three.
Yeah, I can't wear hairspray because I have to put my hair down like slash my freaking scalp. But I'll be dealing with it for a little.
Oh yeah, baby hair.
Yeah.
Those are usually on my ears.
But I see a whole bunch of girls like super tight hair.
So when you look at this,
with a whole bunch of hair.
the first mnemonic that's in here is the one actually there was another one I learned, but this one, the first one they have on old Olympus towering tops, a Finn and a German viewed some hops. That's the one I was taught. You need another one?
Yeah.
I can't count today. All my sugar has not hit the bottom to my brain cells. So a lot of these is, and then the other one that's in here, so one of this names, the first one names all of your cranial nerves. Then also it says here, you may also have learned, some say marry money, but my brother says big business makes money. So and that there gives you different ways to learn things, okay? But that one helps you memorize the function of the nerves. Not so much the nerves themselves, it's the function. What is it related to? What do they do? So this will be very helpful. There are many different ways to memorize these nerves. If you find and there's some nasty ones out there that you can learn to memorize those nerves, and you will find them. Okay, so this is going to help you. And on the next page you'll see where it says order of cranial nerves: olfactory, optic, ocular, trochlear, trigeminal.
Abducens,
Yeah, I can't.
facial,
Thank you.
acoustic, glossopharyngeal,
Mhm.
vagus, spinal accessory, hypoglossal.
Okay, so they all go through here. So those are what you're going to need to remember. Now, this is a 2-pager. Do not panic. Okay? It's not hard to memorize this. You will know the first 8 by heart. By the time we have to do the head to toe, you just be like, la 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 la. We're done. Okay? Now, you're going to get to practice on each other. All right? A lot of these, some of them are kind of the same. Your perla and your 6 cardinal of gaze, you kind of do that all at the same time. It's on the back. Mr. Chris over there is going to come up here and he's going to show you the fancy way to do this. I'm going to pass out the papers and he's going to come up here and reiterate now that his blood sugar is back to normal.
Because it was starting to severely drop. All right. Can I actually steal one of those from you?
I thought you'd know this by heart by now.
I'm just the instructor. What are you talking about?
I think he,
Okay. Let's see here.
Here you go, darling.
Actually, don't even need to know. All right, everybody, get out of your carb comas. How much table do you need?
This is shared.
Oh, it's a shared spot, huh?
Yes. Oh wait, I didn't get one.
Okay. So remember yesterday, I'm gonna be burping now because I inhaled that sandwich.
I was like, damn, you're back already?
Mm-hmm. Oh, trust me, 20 years of being in nursing, you learn how to eat quick. Because you only get 30 minutes for lunch typically, and half the time people are like, hey, your patient's doing this, so then you take a bite, or take several bites to chew on as you're working on something.
When they say they're coding, you just.
Mm-hmm. All right.
I saw that.
So this is your ophthalmoscope. This is the one that you, if you guys are going on to become advanced practice nurses, you would use this to evaluate the retina and stuff, okay? You have to get, I apologize, but you have to get real close and look in their eye with this, okay? It does have a light on it, so you can utilize that light to check their pupils, okay? If you lost your, or you forgot your pen light, all right? This one, however, this is the otoscope. This is the one we get to use to look in the ear. It also has a light, and you turn it here on the switch, and it gets pretty bright, okay? Again, you could utilize this as well. One thing I want to caution you about, when it comes to flashing a light into somebody's eyes, do not go directly into the eye like this, because everybody here, I'm sure, has had that happen at least once. And what happens? Right, you get all these like floater things in your eyes, and it's hard to see. We do need to shine the light towards the eye because we're eliciting a response. If you were to look at your partner or someone next to you right now, their eyes or pupils are going to be way open because they're trying to bring in all the light that they can, because that's what our eyes do. In the back of our eye, we have those rods and cones that interpret waveforms of light and tell us that that's blue, that's green, that's purple, whatever. So we are needing to be in a darkened room right now, because when we go in to do their pupillary assessment, we want to see that change. We want to see the pupils constrict, okay? We have to do both sides too. Now, even though I'm shining my light over on this side, I need to evaluate that side of her, or that eye. Sorry, I didn't mean to flash that at you. Okay, but I also need to inspect the other eye to make sure that it is responding as well, because they should be responding consensually. In other words, at the same time. Okay. You okay?
Mm-hmm.
Isn't true that people with lighter color eyes can see better at night in the dark?
I've not heard that. Have you?
Yes.
No, I was asking Professor Reed. Obviously, you have.
There's no correlation with the color of your eye.
I know that during Nazi Germany times, they were doing all types of experiments to change eye color and
Oh, yeah, that was
all the other
bizarre.
fun stuff. Yeah. Well, apparently, a lot of people don't even believe the Holocaust happened.
Oh.
Yes, I know.
Well, and just so you know, the world's flat too.
Yeah.
I stopped talking to that guy one time because he thought climate change was a hoax. He thought the government.
You dated Trump?
No. He said the government makes up climate change to get money from the people, and I said the government doesn't even really fund climate change like things that much anyway. Like if they really wanted your money, they would be making a big deal about it.
Let me guess, he was also paranoid about the government listening in on his phone or following him?
That's probably. I didn't wait long enough to know.
No, I know Alexa, or my
They all
phones,
listen.
your phones do listen to you,
Yeah.
because you'll be talking about
Oh,
something.
that's
I had
cool.
talked about something, and literally like 2 seconds later, I'm like scrolling through something, and an advertisement comes up for something. I'm like, ooh.
Yeah,
So
So that
yeah.
little
Yeah.
okay that you press that says, is it okay if we like record your data? That's what it is.
Yeah, you
I
turn
was-
off
I
the
was put-
permissions.
No.
Every app asks you.
Don't let anyone do it.
I hate to say it,
Don't
but
customize
honestly, if the government wants to listen on what's going on in my life, they are really freaking bored.
Amen.
Okay? Because they're like, wow, he's sleeping again. No. Now with this, remember yesterday what I talked about with the ear canal? Okay? When you are putting this in, okay, use your non-dominant hand to put the instrument in, but you also have to make sure that you're doing up and back for an adult or a child.
Adult.
Up and back for adult.
Up and back for an adult, down and back for a child, okay? I was taught to hold it like this, so that it's just like kind of out of the way and you can kind of get there a little bit closer, as opposed to trying to go like this. Okay, so however you want to hold it, it's up to you. You guys will be looking at each other's ears, and we actually, did you bring it or no? Okay, so your classmate Kenny, who I apparently tried to kill this morning, brought in, I've seen them on Facebook advertisements. I thought it was a hoax, but apparently not. But the little ear scoopy camera thing.
No way.
Mm-hmm.
So he's got, were you able to get it to come up on the one downstairs?
I can try right here. I don't know. I can try right here.
Well, we will. We'll get there. We'll get there. So we'll put it in like IMAX view. Okay. As long as we can still get it to work. All right. So after you've done your main 8 things, your first 8, notice too what's highlighted on there. We got a pen light. What else?
It's a piercing, but
Otoscope, cotton ball,
Sometimes that'll happen.
coffee.
all the time, right?
I know.
Well, and it's caramel macchiato scented too. Although somebody on Wednesday was like, "Oh, it's not Starbucks caramel
More like, well,
macchiato."
pardon us.
Yeah, right. Whatever you said, Miss Macchiato.
Yeah.
All right. Got cotton ball, fragrance. The other thing that we could possibly have with us, though, because you want to have 2 separate fragrances, but we don't have it here, unfortunately,
Someone's got a piece of gum.
or toothpaste. That's readily available on the floors, okay, because it's basic hygiene need, okay? Or even the mint from the mouthwash,
Yes.
okay? Just as long as you have 2 separate ones. No, you don't want, you know what? You don't want to use hand sanitizer because of the alcohol content. If you have somebody who's nauseous and you're like waiting for the doctor to call back or give you an order for like something to give them, you know what you can give them without a doctor's order?
Alcohol.
An alcohol wipe. And have them smell it. It'll quell their sense of feeling like they have to vomit. Yes, sir.
Oh, okay. Oh no, you can't use alcohol for like smell.
Correct. And that's why. All right. So, we're going to note the general survey. We've done that. Measures vital signs. Instead of doing that, what do you need to say?
I checked the patient's vital signs
I
before.
reviewed their vital signs before entering the room. Okay. Then we have inspect head for size and shape, placement of features, and hair distribution, noting symmetry and skin. Remember what I said yesterday about ear placement?
So the outer.
Mhm.
The outer canthus, as long as it's not lower. Okay. What
Or
else?
way higher.
Or, well, mine are a little bit higher.
I've seen
I'm
some
crazy.
patients-
Oh, I'm sure you've seen some up here, yeah. But what about
One eye.
roughly about 1 eye in between? Okay, I learned that taking an art class, believe it or not, for proper proportions of the face. And let me see. Now, as far as head for size and shape, well, you got a big head. Oh no, that's just hair. But you want to make sure that it's not lopsided or any type of growths under the scalp on the top part of the cranium itself, okay? And you're, again, at this point, what else have you learned so far to do at this point as well? What other thing can you assess for?
Like breathing.
Parasites.
Parasites, because you're looking at the head.
Hair
Okay, you could look at the hair distribution. You could look to see if they got a dry scalp or anything like that while you're doing this as well. You do need to palpate a little bit as well, okay? Again, check the ears and all that fun stuff, okay? Placement of features are good. Palpate skull, neck, and hair. The neck you kind of want to just feel a little bit. Obviously, if they have, or if they've just come in from a trauma, you're not going to touch this area until their C-spine has been cleared. Okay.
Neurosurgeons will come on.
Yes, because if she's got a fracture in here, and even if me doing this causes damage to her spinal cord, she could be paralyzed from the neck down, just from doing this. Because if those bones are unstable and they cut through the spinal cord, that's an issue. Okay. So, let's see. Checking for range of motion, assessing the lymph nodes. So again, we're gonna have them do yes and no. And then, what was the one I told you to do? Valley Girl? Oh my god. Okay. Obviously, though, if C-spine is still in question, we skip those. Okay. The other thing you want them to do is to put your hand up against the side of their face and have them turn their head towards so that they're turning their head against resistance. Go ahead. Okay. Okay, perfect. All right. Also, assessing lymph nodes. You don't need to know all the names of the lymph nodes, okay? You do, of course, want to check up here because we have those ones right in front of the ear. And then typically we go this way underneath the chin, or not the chin, underneath the jaw, on up to the chin and down around the throat for, what's right here? Thyroid, which is coming up on your checklist,
And I
okay?
do have one that you could feel, right?
There you go. And right here at the top of the clavicles. Those are where some lymph nodes can be as well, okay? Check for thyroid enlargement. I know I've been picking on you, but I'm going to pick on Jesse now because he's right here at the edge. Turn so everybody can see. Perfect. So you do want to get, for now, since you guys are still learning, it is best for you to palpate the thyroid from behind. What you don't want to do is palpate way over here, because what's there? Carotids. Okay? You want to be more towards the center. You feel like for the most prominent bit, which for you, Jesse, is right here. Okay? And then kind of go to either side. And you're just feeling for any type of differences. If one side is a little bit more poking out, that could be swollen or misshapen of some sort, and you're just kind of feeling around. At this point too, later on it asks you to have the patient swallow so that you can evaluate their swallow. You're here now, you can have them do that now, so go ahead. There you go. He's like, hold on a second. And you're just feeling for this section of the Adam's apple to go up and back down, okay? Because with the Adam's apple moving up, that means that the epiglottis is able to slide down, cover the windpipe or the trachea, so that way when they're swallowing and food or liquids going down, the airway's covered so that it doesn't go into the lungs. And then once it comes back up, so it's almost like a trapdoor or like those automatic trash cans that you wave your hand over and it goes up and then comes back down, okay? Test cranial nerve 5 by having the patient bite down, close eyes, and then report touch. So, right here on either side of your jaw, what muscle is this? Masseter muscle, right? We use it all the time for chewing, talking, moving our jaw up and back, and all that fun stuff. Bite down real quick, and I want you to feel that. Okay? Both sides are engaged. Okay, if somebody's having a stroke, the side that's affected, they might not be able to engage that muscle, but you might feel it on just one side. Okay, if that nerve is what's being, affected. Excuse me. So we want to have them do that. Have them close their eyes, and this is where the cotton ball comes into play, which is where?
Right there.
Right there. Okay. Now, you don't need a whole heck of a lot. In fact, I didn't even have the other group do that, so you guys are like my A-list. Okay, so you just want to get a nice little wisp like this. Have your patient close their eyes. Close them.
No peeking.
No peeking, and just have them tell you when they feel something.
Right there.
I wasn't done yet.
Oh,
You have them tell them where you feel it.
Tell me where you feel it.
on my cheek.
Your cheek. Oop, that was like
my forehead.
right.
On my eyebrow.
Right, left.
My ear.
Gotta say right or left.
Right or left, yeah. All right. Now, in a pinch, if you have to, you can use a cotton-tipped applicator and just get a couple wisps off and use that as well. Sometimes you might not even have access to that, so then you just might want to very lightly touch their face and have them report to you what they're feeling. Okay. Then we have to test cranial nerve 7 by asking patient using different facial expressions. So remember during that FAST assessment yesterday when we had them smile, right? The other option to that is, well, you should have them smile, frown, relax their eyes, and that's their model face. No. This folder. Yeah. So
Model face,
smile,
model face.
frown, and what else?
Show me the teeth.
Upload your cheeks down.
Puff out their cheeks. Okay? And that's that bit. Testing number 11 by turning the head and shrugging shoulders against resistance. Well, I had her turn her head, right, against resistance already. So now, hands on either side and have her shrug. And that's your accessory, or cranial nerve 11. All right. Now we get to move on to the eyes, the windows to the soul. Okay. Inspect the eyes and the areas surrounding, including hair, eyelashes, any dripping lids, color of sclera, and inflammation. She's like, damn it, I just put my hand down. But yes, you're going to look at her eye, or your patient's eyes. At this point too, you can even take your thumbs and just peel down their conjunctiva here to look and see that they're nice and pink. They shouldn't be pale, they shouldn't be red, they should be nice and pink, just like yours, okay? You could even too, at this time, you could palpate the sinuses if you wanted to, okay? Up here, and then underneath the eyes, okay? Then, I don't see any drooping of her eyelids or anything like that. Her sclera is nice and white, which is what it's supposed to be. It shouldn't be red, it shouldn't be yellow, okay? Track lower lids to note conjunctiva. We've already done that. Now, inspect the iris pupils, noting size, color, and shape. Yes, not everybody's pupils are round. Some people might have an elongation and look like a cat's eye. Okay? You would need to note that. Huh? Mm-hmm. So, we're going to look and see what color our patient's eyes are. They're in a lovely shade of brown. Okay? So she's FOS? No. Full of... This is how I tell if you're paying attention or if you're falling asleep or on your phone.
That's me. What if you just start talking?
Oh no. Alright. So now comes the most intimate part of this.
Good night.
Okay. So again, I am going to come up from the side. And you can even just shine the light across the eye, as long as it's just not directly like this, because that is just, if you have a patient with a migraine or any type of headache and you do that, you will probably get punched, okay? And this is also, too, really important to have good, fresh breath. So that's why I'm sorry, I had onions. But it was so good. So I'm just going to come across and kind of just shine the light, and I'm looking at the light or the eye that I have the light on, and you want to have them look straight forward, okay? Checking out that eye, okay, that responded appropriately. I'm going to come back, shine that light in that same eye, but instead of inspecting that one, I'm checking the other side to see if it does the same thing it's supposed to, okay? Then I can come over here and do the same thing to this eye. And then the other one. Now, sometimes people will be like, well, when are you measuring the size of the pupil? You want to see how small it gets when it reacts, okay? That's what we're looking for. Sometimes people, if they are on high amounts of opioids, they might have blown out pupils and they just don't close because they're just like, dude. Your iris is a muscle as well, okay? And so with opioids, yeah, well, typically, yeah, it could be way out on the other direction as well. But typically with opioids, they relax muscles, so then they open up. You can have it sometimes, although I've seen it more with stimulants where they are pinpoint. And that's, they're like, what? Typically why people who are stoned, they will be like, what? What'd you say? Or they're like, wow, that's bright, because depending on how open their pupil is, okay? So now we've determined that her pupils are equal, round, reactive to light. We haven't done accommodation yet. That's coming up, okay? Yes, sir. Yes, correct. Because you're accommodating for depth. All right, so I'm going to have her follow the tip of my pen. It could be your pen light, your actual like writing utensil, your finger even, okay? You just want to give them something to focus on and have them do their 6 fields of gaze. So that's 3, 4, 5, 6, 6. Okay, and I always come back to the center, and I always align that with their nose, because then once I'm done with those 6, I can do this. And I should see her eyes kind of cross and accommodate, and then come back out. Just by doing those exercises, you have tested for which cranial nerves? We went over this in class yesterday, so hopefully you still remember.
3, 4, 6.
3, 4, and 6. 3, 4, and 6. We tested for cranial nerve 5 when we did the touch. Okay. Now, since we still have our light, okay, we still have a couple orifices that we need to check. Okay, within the head. Calm down. Okay. So, we haven't even really gotten to the ears yet. All right. I'm going to have you tilt your head back, and I'm going to look up her nose to see if there's a bean that she inhaled when she was 4. Okay. Or the Lego brick that some kids put things.
Crayons.
Huh?
Crayons.
Crayons, Teddy Grahams, all those fun things. Paper. Okay. Well, and adults are guilty of that too, because they'll take the tissue paper and like make a little finger out of it and go up there, and then they don't realize that it can break off if it's too wet. Yeah. And then then we have to go in with septum hemostats and grow it out.
I did this one kid that had paper stuck in his nails for like a week.
Oh my God. What?
It wasn't me.
So now I'm looking at her nose and seeing 2. I should be able to not see her septum. Okay? The septum is right here on the outside of the nose, but inside where I'm looking, if it's lined up perfectly, I shouldn't be able to really see it. If it's deviated, I would be able to see it. Okay? So now I'm going to have you open your mouth. Ah. Stick your tongue out and say ah. No, out. There you go. Ooh, you have a sore throat? Your tonsils are a little red back there. But I'm also looking at the surface of her tongue, making sure that her tongue is nice and pink. Looking at her teeth to see if there's any redness to the gums or any appliances like dentures or partials or anything like that. Go ahead and lift your tongue up. Checking her bottom teeth, her lips and her mucous membranes are nice, clear, and intact and moist. Okay, all those fun things. I also checked another cranial nerve at that same point. Any ideas?
11.
No, this was 11, but 12, hypoglycemic. By having her go ah, when we have her stick her tongue out, we're seeing if it's midline as well. Okay, and then the uvula in the back moving the way it's supposed to. Okay, so now we can move on to the ears. All right, now how many of you guys got the whole palpating the tragus part right during your little quiz today?
Yes.
You know? Why not?
I didn't know what the tragus was like.
You didn't know. In this day and age, with everybody having that pierced,
Yeah. I don't have any piercings. I mean, I used to. Like, if you don't use it, it's alright.
I will say this one is kind of difficult. Most of the ones in the hospitals, they have a little button that these push off, kind of like with the oral thermometers. This one isn't so fancy, so you have to like line up this little line in here with this groove to get it to go on appropriately. There we go. Okay. So these things are disposable. Use one per patient, or if you have if you discover that your patient has an ear infection in one ear and you haven't assessed the other one, don't bring it around. Okay, unless I mean, sharing is caring, but not with infection, okay? But I'm going to take this, I'm going to peel her ear, which way?
Up and down.
Up and back. Okay, and I'm gonna line this in there, and I'm looking for her tympanic membrane to see if it's nice and pink, or pearly gray color, but overall pink. It shouldn't be red, it shouldn't be yellow, it shouldn't be blue, it shouldn't be purple. And that it is clear in that there's nothing drainage-wise behind it. If there's yellowness or an extreme amount of redness, that usually means that there's an infection or inflammation of some kind, okay? Then I'm gonna come over, and as long as that one's nice and clean, okay, I'm gonna come over and do the same thing on that ear. You might encounter cerumen, okay, earwax of different colors. It could be brown, it could be maroon, it could be yellow, just depends on the person's diet and their body chemistry. You might encounter bugs, crickets, cockroaches, spiders. What? Yeah, no, I'm like, no, my ears starting to itch. I can handle MRSA, I can handle any type of infection, but bugs, no thank you. All right. The other thing we want to kind of percuss over, or at least palpate, is the mastoid process back here. Okay, just to see if it's sore. Why would we need to check to see if that's sore?
Because it has something to do with the lymph nodes, or no?
No, that's too far back.
Maybe your jaw.
Eustachian tubes?
No,
Wait, where is it at?
right back here.
Sometimes if your lymph nodes are swollen,
is
it's
it-
right there.
Usually that's related to these ones here, or your periauricle ones, but not way back here.
But sometimes I saw pictures.
Mine were swollen back there.
All right, you freak. No.
Fluid and,
But if their mastoid process itself is painful, they might have had, usually that's after like a traumatic accident, trauma. They may have hit their head and broken a bone, or even like a hairline fracture back there. Okay, so that could be an indicator of something more serious. Testing for hearing, we already know about that fabulous, highly technically advanced whisper test. All right. Use the otoscope, inspect the ear canals and the tympanic membrane. We did that. Assess the nares, septum, and nasal mucosa. Have patient identify scent to check for CN1 function. Here's your coffee. Okay, we don't have any mint, but I would have my patient close their eyes, and then I would take the cup in front of them and have them take a nice deep sniff and tell me what they smell.
Coffee.
Just go.
Oh yeah, a lot of coffee.
This is what you had the first time. Nothing.
I felt a little bit. That's
Yeah,
why I was
this
like...
is strong. I mean, yeah, it is strong. They're all like,
Lies.
it's just on my hands.
That one